everybody, and welcome back to another interview with Roger Duckworth. So I was amazed to find out that there are 190,000 migraine attacks every single day in the UK. And interestingly, there is a charity called the Migraine Trust who holds a Migraine Awareness Week at the beginning of September every single year. But what those sufferers might not know is that good treatment can be from the form of physiotherapy. And that's what I'm going to be asking Roger about today.
Yeah, so it is quite an astonishing number of people that suffer headache and migraine. 25 million days lost in the UK to work and school because of headache and migraine. It's a massive problem, and it's right up there with back pain in terms of that which presents to physios and doctors. And unfortunately, a lot of the medical world really do struggle to know how to help a lot of migraine sufferers. Fortunately, physiotherapy can be very helpful. It doesn't fix everyone, and I would never make claim to fix every migraine sufferer out there, but there's a huge number that we are able to help. Even people that don't think that we're going to be able to help them. So there's a lot of myths around. A lot of people feel that, it's hormone related or it's dietary related, and it's brought on by wine or triggered by eating chocolate, and so I must have an intolerance. Actually, most of the time, that's not really the cause. That's just a trigger, and we can go on today to talk a little bit about how the nervous system is tied in with those triggering concepts.
Do you mind talking to us about some common myths, like you said, in terms of the drinking wine or certain foods that might affect you? So some other myths that people might come up with could be that they haven't had enough water or they haven't had enough sleep. Do you think they're triggers as well?
Okay, so I think we'll talk a little bit more about some of the classical models of treating headache and migraine and the work of Dean Watson and people like that, and then maybe go on to talk about some of the other approaches that I tend to have. And certainly hydration can be a really, really important factor, but again, I'm not sure it's necessarily a whole trigger or a whole cause. Certainly in terms of migraines, that it's often used to be thought that it was a circulatory problem, and actually there's very little evidence for that. In fact, they've put people into MRI scans whilst they're in migraine, and the studies show that there is no change in the vascular diameter, the diameter of blood vessels or blood flow change within the brain during a migraine attack. That actually dates back to something like the 1850, 1860, where the throbbing nature of a migraine or headache sometimes was because it was pulsatile. They thought that it was connected to the pulse and therefore circulatory. But look, we've all had throbbing pains. If you sprain an ankle, it can throb. The throbbing pain doesn't mean that it's circulatory.
You mentioned then about Dean Watson. Do you mind going into a bit more depth?
Yeah, I had the privilege to have known Dean for well over 20 years now. One of the first sort of cohort of physiotherapists to be trained by Dean in the UK, and certainly one of Berkshire's only advanced level practitioners certified by Dean in this area. So Dean, we owe a great deal to. Dean is a physiotherapist in Australia, and he runs now a chain of headache and migraine clinics. That's all he and his team treat. He's a doctor now, he lectures around the world, and his research he's undertaken has totally revolutionised the sort of management or the acceptance of the management and the role that physical therapy and other manual therapies can play in the management of headache and migraine. So Dean and I don't agree on everything. He very much works with the upper cervical spine, the upper three segments of our neck, and there's a lot of connection between the upper three segments of our neck and an area within the brain which is called the trigeminocervical nucleus, which takes information from the side of our head and face, the upper three segments of the neck, and into the brain. And that area can become sensitized by restrictions, blocks, issues in the upper neck in particular. And this trigeminal area, this is often where people feel what they'll describe as the aura. They'll feel this odd sensation around their head. And the aura feeling is associated with some disturbance to this trigeminal field, or this information coming in from that area. There's always information in our nervous system, and it's going up and down all the time. We're more or less sensitive to the stimuli coming in. We talk about a sensitized nervous system. So a nervous system which is sensitized is sort of up-regulated. It's more jumpy. It's more likely to respond to incoming signals. Extra information coming in from abnormal issues, blocks, restrictions, whatever we want to call them, from the upper part of the neck. If that's causing extra signals to go into the brain, it sensitizes it and makes it more likely to react to other normal signals coming in. Now, this is partly where the so-called sort of myths of menstrual migraines and caffeine and other strong stimuli can come in. We know, for example, that as our estrogen levels change, that's connected to serotonin levels. Serotonin is a nerve transmitter in our brain. Now, if we change the levels of serotonin in our brain, that can up-regulate or down-regulate also this sensitivity in the nervous system. So we can begin to see, if you get a normal fluctuation change in estrogen level that would create a normal fluctuating change in serotonin, all it takes is, if we've got that background neck problem, and then the serotonin level changes because your estrogen levels changed, all of a sudden your brain goes, I can't cope with that, and generates pain. So to all intents and purposes, you are quite rightly making a connection between the fact that it comes at certain times of the month according to hormonal fluctuations, but it's not the hormone that's the fault. All it's doing is just taking away some of the blocker, if you will, in the nervous system, and allowing the real problem to start to sort of show its face.
Was there anything that got you particularly interested in treating headaches and migraines to begin with?
If I go back in my early part of the career, I tended to treat a lot of knee problems, and I've always been known as quite a sort of hands-on spinal physio. And I think patients presented, and because I saw such a lot of neck problems, you would find that it would often go with people who would be coming in complaining of neck pain or neck and shoulder pain, but they'd also have a lot of migraines. And I began to sort of see a connection and think, jaw problems, inner ear, tinnitus, balance issues, sinus issues, these all seem to happen together, or they often do. And I thought, there's something in this. And so that led me into who's leading the field in headache and migraine, and go and train with them. So I did. Yeah, so I think it was just really my interest in sort of the spine that led quite naturally to that, yeah.
Obviously, in the practice, you like to take a holistic approach for some patients, and I know you mentioned then that a lot of these issues can all come at once. So do you kind of go in with a holistic approach when you're treating these migraines? Yeah, absolutely. I think, look, when a patient walks through the door, I'm just assessing them, and I don't decide. It's not like turning up to a beauty therapist and going, I'm doing a back and neck today, or I'm doing a this, or I'm doing a that. It's not. I don't determine what on earth I'm going to do with any patients until they walk through the door. It's a blank sheet for me, and then we'll go through a journey of exploration together. It's like being a detective. I'll just take clues really and listen to the clues in the history that the patient brings to me. For sure, this is where, as I mentioned, Dean and I think he sticks to treating the upper three segments of the neck, and I chatted with him in the past about, well, what about other issues lower down, or even if it's mechanical, and saying, well, what if, what if the issue is lower down in the back and there's a restriction there, or we've got some block in the pelvis or they're not moving correctly, then surely we have to address the foundations rather than, just what's going on at the top. And that's my view, and he's, well, look, the headache's not coming from there, and that's what I'm going to treat. I think the other thing for me though is I don't believe that it is all mechanical, and again, as my career has progressed, certainly doing a lot of the trauma work, people can actually experience headache or migraine
when they are particularly stressed, it can manifest in that way, either because of tension that's going to that area. I do think that the body is way more complex than that, and our nervous system is way more complex than that. And so I do look at the onset, when things began. That can give us clues. Did this come at a particularly traumatic time in their lives, when the parents separated? Did it come? It often comes in, particularly females, around about GCSE time. I see a lot of young ladies with the problem then, and that's not a coincidence. It's how their body's learning to, where their body's storing that tension and stress. And then it might be that I'll take a different approach. I might release the tension in the neck, but I think it's important to make those connections to help them understand that's how their body is trying to cope or failing to cope with the stresses they're experiencing, and maybe give them some different strategies and tools.
Obviously, you may take a holistic approach when someone comes in, but are there some other ways that you can deal with treatment? I know that you've mentioned before about kind of perhaps cranial work or energy work, or there's lots of different approaches. If you could go into some of those for us.
For sure. Certainly cranially, either a cranial osteopathic approach, which was the first sort of toe in the water for any kind of cranial work I did a long time ago. That's a bit more mechanical, traditional cranial osteopathic work. But sort of craniosacral work, personally, I think it's massively overlapped with other energy work, chakra work, brow chakra work. I don't really mind what the label is at the end of the day. I just make contact with the patient, listen to them, get the clues, see what I feel under my hands. And I don't really mind whether that, I might be in my mind thinking, okay, is this more of a chakra-based thing because of something else that the patient's brought up, and is that energy? I might not particularly, patients might not feel comfortable talking about it at that level, or they might. So I'm not lying to the patient. I'm just going, well, look, the more I think that we look at these different systems of thinking, of cranial work and chakra work and energy work or acupuncture or shiatsu, there's so much overlap, and I just wish we could stop worrying about what we want to call it, because that can get in the way, and just go, look, there's something going on there, and I'm doing something, and I'm working with the body with whatever I feel is going on. And that could be connected to something going on mechanically lower down. It could be going on with some locked up emotions in the body. I don't really mind, but we just go with the flow when the patient walks in the room, really. Okay, thanks for listening today. If you've got any questions, pop them in the comments down below, and we'll do our best to get back to you. Please subscribe and hit the little bell so you get notifications when we get other videos for you. Perhaps you're suffering, or somebody that you know and care about, perhaps a family friend. Please share this with anybody that you feel suffers and might be struggling to find a solution to what we've described as a massive problem and really debilitating problem for many people. And whilst I wouldn't want to make any promises that I fix everybody, there are so many people that I have been able to help, and people that have cried because they've suffered for 30 years unnecessarily. So I get my joy out of helping people, and if I can help somebody that you care about, then that would be amazing. Thank you.